going to go ahead and do my question and answer video. I've had everything up for a few days, and I've gotten some questions, so I'm going to go ahead and try to answer them for you guys. So let me get my questions out here. So one of the questions was, did I take any classes to prepare for natural childbirth? I didn't really take any classes. I did with my son. I just took the normal childbirth education classes 2 years ago, so I didn't sign up to take anything like that this time. I did have a doula, and we did a lot of it was kind of educational, like any questions that I had, she would answer for me. But a lot of what I did to prepare for natural childbirth was actually just kind of research on my own. Ina May, any book by her has a ton of information. I think it's called The Guide to Childbirth. If it's not, I'll put an annotation here, but that book has birth stories in the beginning of it. I think it's in the beginning. And then the rest of the book is just educational, and that was a really great resource for natural childbirth. Natural Hospital Birth is another book that I read. So I think kind of the education that I did have on natural childbirth was more from just research I did on my own. And then, if I had any questions about anything I read or saw, then that's when I would talk to my doula about it and get a more professional opinion on things. I also would talk to my doctor, but people like doulas and midwives generally are more trained in the natural aspect of birth. And I also, if you get on YouTube and you watch videos, there's something called My Birth TV, and it's a website and a YouTube channel, and it has tons of videos of natural birth. It's kind of like the shows that you see on TV where you hear the background of the story of the woman who's pregnant, and then you see them like when they're pregnant and in labor, and then afterwards, like a baby story or something. But they're all the stories are of natural births. Most of them are not in the States. All of them are home births. Some of them are water births. But just seeing birth happen like that, for me, made me much more confident that birth is natural. That's what our bodies are supposed to do. And just building trust, being a woman, knowing that my body could do it, and witnessing it, watching all of these births. Okay, so the next question is, how did you know what your expectations were? I didn't really have any expectations of what natural childbirth would be like. I had the induction with an epidural with my son, and I have amnesia to most of labor and delivery. So even having been through birth before, I still didn't really have any expectations because they kind of got thrown out the window when I couldn't remember anything. But I think what they're asking was, like, how do you know what your options are? What are your options for pain management if you're not going to have an epidural? I think that's what you're asking. If it's not, let me know and I can answer a different question, but I think that's what you're asking. And there are options for pain management when you're unmedicated, but I think research is the best way to know kind of what your options are. Like, a lot of the books that I read made it very clear that if you fear birth, or you have some fear or something psychological that worries you about birth, it can like stall labor or make your perception of the pain be stronger, and things like that. So it's good if you have fears about birth to address them ahead of time. That's one way to make a natural birth easier on yourself, is to figure out what you fear about it and try to address that before you're in labor. And then as far as like actual things you can do besides an epidural, one thing with natural childbirth is you actually feel the pain. And the best way I can tell you, and the best way I make sense of the pain, and this was in my other vlog, but is to know that you're in pain for a reason. If something's really hurting you, you're going to probably try to move around and get in another position to decrease the pain that you're feeling. And I think that pain is for a reason, because it kind of naturally guides you to get into the positions and to keep moving and to keep helping things progress. Because every time you take an active role in your labor, like if you are on the birth ball and now you want to, I don't know, squat or lay down or rock or sway or whatever you want to do, all of those times that you are actively involved in your labor helps you progress. It did for me anyways. And I think it helps the baby descend in the birth canal and get into the best position for birth. And so the best thing I could tell myself when I was having contractions is they're all for a reason. And I just listened to my body and let it guide me into whatever I needed to do. When you have an epidural, you don't feel the pain, so you don't take any active part in helping your labor progress. You just, I don't know what you guys did or do when you have an epidural, but when I did, I slept for hours. I slept from like 4 centimeters to 10, or like 9.5 or something. So I was asleep for the hardest part of labor. I just slept through it and didn't take any active part in it. And yeah, so, but other things, like you just have to know what relaxes you and then communicate that with whoever is supporting you. When I was in labor and people would ask, do you want this? Do you want that? Do you want this? Do you want me to do this? When I was in transition, which was when I was actually being helped through labor, I kind of labored on my own until I was about 7 centimeters. But I would just say I don't care. And I kind of did care, but not at the time. So my husband and my doula knew the things that I had told them ahead of time that help relax me. And so they just kind of, without me telling them what I needed, knew. And so those discussions are a good thing to have with your support person ahead of time. Like when I was in the water, effleurage really relaxes me, like the hands on the belly and the circular motions. When I was in the water, I couldn't have effleurage, but my doula had a scoop, and she kept pouring hot water over my belly, and it was the same relaxing effect. My husband, he kind of like just stroked my hair on my head, and that really relaxed me. When I was kind of losing it, they would say, look me in the eye. They brought my focus back, or they told me, focus on something. If they saw me clenching my jaw, they would kind of touch my jaw to remind me to relax, and things like that. So having those discussions ahead of time really help you. And I'm looking at questions over here as I'm talking. The TENS machine is something you can use. I have a TENS machine and didn't use it at all. For me, heat and water are my choices for distraction/pain relief, because I don't know what they really were. But and I think a doula is an excellent option for pain management, because they know all the tricks and they can really help you get through it. There are other options besides an epidural medically. There are like IV medications they can give you. That's not something I ever looked into, because I hate feeling drugged. Like, I don't even like drinking alcohol because I hate feeling in that altered state. I just don't like it. So having IV pain medications was not something I even thought about. But I do know that's an option, although if you want an unmedicated childbirth, then that wouldn't be. So, and depending on where you live, a lot of countries will use gas and air, and it's something that you like bite down and breathe in this gas, and it kind of helps to calm you down. A lot of women who use that, they say it is more of a distraction than pain relief, but that it does help kind of get them away from the pain. So that kind of depends on where you live, though, because I don't really know of that being used in the States. Maybe it is with a midwife and a home birth, but I'm not even sure about that. And then another question: how did you vocalize to your doctor what you wanted in labor and delivery without sounding demanding or rude? That's a good question. And my doctor delivered my son, and so she knew how hard the delivery was on me and how hard my recovery was, and that I had to go through physical therapy and everything else. And so when my very first appointment with her when I was pregnant, I said, and I feel close enough and comfortable enough with her, having gone through an entire pregnancy and labor and birth and recovery with her, to kind of just say whatever. And so my first appointment with her, I said, so put this in my chart in big letters on the top. I said, I may beg to be induced, but do not offer me an induction. And I said, I don't want to go down that road again. I said, when I'm hugely pregnant, I will probably say yes if you offered it to me. But I'm telling you right now, that is not what I want. And that kind of just started the discussion for us about what I did want out of birth. And it is important to talk to your doctor about what you want. And the more educated you are with and not even educated, but the more you know what you want. I'm not saying the doctor is not going to believe you, but a lot of doctors, if you are like, yeah, I want to go natural, if you kind of sound wish-washy, they may not listen to you. But if you actually sound like, this for real is what I want to do, I'm hiring a doula. A lot of times if you throw your doula in there, they know you're serious because you're paying a lot of money to someone to help you get what you want out of your birth. But that's another way to start the discussion. If you are going to get a doula to support you in labor, you can ask if they've worked with a doula before, if they're open to working with a doula. And that can really help you kind of get a feel for if your doctor supports natural childbirth. You can, if you are just meeting your doctor, you can ask them, do you routinely cut the cord right away? Do you routinely perform episiotomies? Am I allowed to drink when I'm in labor? Like, you can ask them questions about what their policies are to get a feel for the kind of doctor and the kind of philosophies about birth that they have. And also that will let them know what you are, the kinds of things you're thinking about. And then when I was probably like between 25 and 30 weeks, we started having more serious discussions about, is it okay if I eat in labor? Is it okay if I labor in the tub? Is it okay? Are you okay with me pushing in whatever position? Do I have to be monitored? Do I have to be in bed? Can I walk around? And things like that. And I just asked the questions. I would write a list of questions for every appointment. I would ask maybe like 3 of them. And then my doctor really supported what I wanted out of my birth. And she's just an amazing woman. And when it came down to questions like, okay, well, now we've figured out what you're okay with. What happens if I go into labor when you're not on call? Will the other doctors just go with what I want because you say it's okay and you're my doctor? Or do I have to follow their policies? And then she said, well, most of the doctors that I work with have very similar philosophies to me. But she said, I'll tell you what, I'll give you my cell phone number, and when you go into labor, you call me. And if it's possible, I will come in even if I'm not on call for a delivery. And that's what turned out happening. I just called her the morning I was in labor. I said, I think the baby's going to be here today, and we are headed into the hospital. And she knew I wanted to labor at home, so she knew I was probably pretty far along in labor. So she headed right to the hospital then, and she was in my room and supported me the whole time I was in labor, and it was awesome. So just find a doctor who you feel not wants the same thing as you, but wants the same thing for you. Like if whatever you envision for your birth, they should support you in it. And if that's not the doctor that you have, try to find one who is. I mean, you're paying for their services, so you should pay for someone who supports what you want. So, and how did you mentally prepare for natural childbirth? Okay, so they said when they were with another child, they made it to 8.5 centimeters, and thought they made it pretty far, but the thought of pushing the baby out would hurt more than the contractions. I didn't mentally prepare for natural childbirth. I don't know that you can, because you've never experienced that kind of pain before. The only mental preparation I did was to learn some relaxation techniques, to focus on breathing and things like that, and the knowledge that I had and the trust in my body that I had at the time I went into labor. But I don't know that you can mentally prepare for the pain that you'll be in, because some women don't feel as much pain. Some women feel an incredible amount of pain. It might depend on the position your baby's in during labor, if you have to be on Pitocin. But I'll tell you, contractions were not that bad until I got to 7, and 7 to 10 is transition. So that's the worst part of labor. And everything I read said when you're in transition, you'll know, because even during your breaks in between the contractions, you won't be able to think. Like, you won't be able to focus on anything around you. You won't know what's going on. For me, that wasn't true. In between the contractions, I could laugh, I could have a conversation, and then as soon as the contraction came, it was serious, deal with the contraction. When it was over, I would jump right back into the conversation I was in. So what I read about transition wasn't like that, but when the actual contractions were happening in transition, they were pretty intense. But I don't feel like once I hit 7, I don't think my contractions were any worse at 7 than they were at 10, except for I started feeling the urge to push, and I fought it for a little while, and that was probably the worst thing. And then the person who asked this question says, I know when you said you pushed, it felt better, but did you mean it did not hurt as bad or just different? So I didn't know this until after I had the baby, but from all the pressure of the baby's descent, your body kind of numbs itself from the pressure just alone, kind of pushes on nerves and kind of numbs you naturally. So I tore a little bit. I didn't feel that. The ring of fire was not that bad. I felt it, and I told the doula and the doctor, I feel it burning now. And then they just coached me, like, don't push, just blow, and things like that, to let everything stretch out. But honestly, the ring of fire was like nothing compared to the actual pain of transition contractions. So it was less painful than contractions. And like when she actually came out, it was just pressure that I felt. It wasn't pain, because I do think your body kind of naturally numbs you. I was worried about feeling the tearing. I was worried about feeling them repair any tears that happened. The most uncomfortable part of the delivery was after she was born, and I had a tear on the side, and the umbilical cord kept hitting the tear. And that was really irritating until they numbed it to stitch it back up, and then it was fine. But that bothered me more than the actual delivery. So, and pushing, when you push with the contraction, you're working with your body. So it definitely takes the edge off of the pain of the contraction as well. So pushing for me was a relief in every way. Um, and I think that was all the questions about natural childbirth. I did get a question on newborn cloth diapers, and someone wanted to know why I why I chose the cloth diaper. And sure, it's for the environment and the money and everything like that. But once we started cloth diapering my son, he didn't get diaper rashes anymore. I feel like it's more comfortable for the child. If I let my son pick between a disposable and a cloth, he will pick the cloth every time. And he's 27 months old now. So, and then the reason I switched to cloth was when Pampers added the Dry Max to their diapers, babies were getting chemical burns. And when I saw the companies not doing anything about it, I realized that they didn't care. And just the thought of my baby sitting in chemicals all the time that could be harming them, that's the real reason that I switched. And we are using some disposables with her now, just because we had bought them when we were trying to conceive for 7 months. And so we had like a stash of them, and some people got us some. So we've been doing both. Just because the price of newborn cloth diapers for the size of the stash that you need for the baby to wear for a month is a little ridiculous, I think. So we're doing half and half disposable and cloth right now. And I hate when I change her disposable diapers and, like, you know, you'll hold them up and smell to see if they've pooped or whatever. And I just smell chemicals. Like, it's almost like a fertilizer smell. And that really bothers me. So we're almost, I think we have 3 packages total of disposable diapers. So, and they're just the small packages. So we're almost out of those, and we'll mostly just be in cloth. I didn't want to just waste the diapers that I had, because I don't want them to go in the trash or anything. But yeah, I don't know. That's why we cloth diaper. It's better for their skin. They're not sitting in chemicals all day. And when given a choice, my son chooses cloth, which tells me a lot and says a lot about cloth. And also, my son can rip a disposable diaper in half, and does when he wears them. Like, he'll pull the tabs off and stuff. And he can't get out of his cloth diapers as easily. He still can, but not as easily as before. So they function better for us too. And newborn wise, they don't blow out cloth diapers like they do disposable. So that is pretty awesome. We go through less outfits today just because the poo stays where it should. So let me see if I have any other questions real quick. Okay, I think that's all the questions that I got about labor, delivery, and newborn stuff. All right, well, thanks for watching. And like I said, if you have any more questions you think of, send them my way. If I don't get enough, then I'll just respond to your comments. But if I get enough questions, then I'll do another video. So here's little Annabelle. Oh, sweet pea. All right, thanks for watching, girls. Bye.